it's very, very exciting. And, I'm not an investor, but I'm more of like a futurist. I'm always forward looking. And like you and I were talking about before, the amount of acceptance and adoption in digital health, like we've leapfrogged 5 years worth of that growth curve in the last 60 days. And I don't think we're going back. We might recede a little bit, but if I was an investor, I would be banking on that now. I would be getting in, because it is more promising. The outlook is more promising than ever before for this sector in healthcare. Yeah.
I completely agree. And one of the things that we're doing to try to capitalize on that faster is think outside the box about who our potential partners could be. And as it happens, because what we're doing is basically like a custom health information exchange with data visualization and analytics layered on top, there are other people who maybe need the same data that we're working on getting access to for different reasons. We're in conversations with a big company in the healthcare analytics space that is still getting data from its customers by getting flat files pushed to them, which is a very 1980s way of doing things. And we were immediately interested when they told us, hey, we've talked to InterSystems, we've talked to Redox, we've talked to all the established players, and no one seems to have a right-sized or custom solution to this. Everyone either wants to push us something that's really one size fits all and doesn't make sense, or they want to charge us an arm and a leg to solve this problem. And as we dug deeper, we discovered, the data that they're interested in pulling, there's like 80% overlap between the data they need and the data we need. So there's an opportunity here for us to license just a portion of our technology to them and potentially get implemented in 600 hospitals in one fell swoop. And then, even though it's not all of our technology in those hospitals, if we wanted to sell them and they said, well, what does the implementation look like? Well, we'll say, well, we've already implemented the hardest part because we already have the data exchange framework ready. It's just flipping a switch to put this other add-on in.
Right. Yep.